Hi, I'm Megan. Today we're going to stain a blood smear so that we can look at it under the microscope. Now here in this hospital we use a right stain, and so the times that I'm going to give you for leaving the slide in each jar are consistent for what we use at this hospital. It may be a little bit different where you are. It's also important to make sure that your stain jars stay clean and that they stay free of debris. What we do here is we have a set of stain for our CBCs and cytologies. We have one for urine and we have one for fecals, and that's so that we don't cross-contaminate and start to get really interesting results on our different cytologies and UAs, so we make sure we're not mixing things. We also empty the stain out of these jars, clean the jars, and let them dry at least once a week. So that's going to vary also depending on where you are and how often you use them. But you can get things that grow in your stain that will show up on your blood films, and it's going to, you're not going to know if that came from the animal or if it came from your stain jar. So it's important to make sure that you're keeping things clean. So first what I'm going to do is just remove the tops of all of these. These stains all contain alcohol and they will evaporate away. So it's important to keep lids on them when you're not using them. To keep my fingers out of the stain, I'm going to use this little tool here. And I've made sure that my blood film has air dried, and I'm just going to start in the first bucket there, and I'm going to let it sit for about 15 seconds. You can move it up and down and kind of dip just to make sure that you're getting good coverage on there, but 15 seconds is a good amount of time for that to stay in there. I'm going to remove directly from stain number 1, move it into stain number 2, and again 15 seconds in there, and then from stain number 2 into stain number 3 and another 15 seconds. Now depending on what you're looking for on whatever you're staining, you may need to leave it in a different color for a longer period of time. For instance, if I'm doing a platelet check, I may leave it in the dark blue stain for longer because that will stain the platelets a little darker and they'll show up better for me. You're going to find a technique that works best for you and is easiest for you to read. So this may be a little bit of trial and error. Once I'm done in the last stain, I'm going to rinse my slide with some distilled water, and you're just getting any excess stain off of it. And after that, I'm going to let it air dry. And that's how we properly stain a slide.